Hi, my name is Sam Most, and this is the 9th video in my series overviewing various chapters from my new textbook, Comprehensive Rhinoplasty Structure and Preservation Methods. It's the first textbook that covers both structure and preservation, so it's very timely in that fashion. It's from Quality Medical Publishers, and you can check it out online. So this is chapter 9, and this is about controlling tip projection and rotation. And I'll just say up front, my primary method for doing this is a tongue and groove method of some sort, and it's not the original description by Foda and Kreidel about a modified technique. But let's step back and talk about my approach to the tip in general. It's really important to understand 4 key concepts if you're a rhinoplasty surgeon or a patient even with regards to the nasal tip. And those are the 4 factors of volume, geometry, rotation, and projection. And these arrows in this diagram are meant to show you that all of these things are interrelated, and anything you do to one will affect the others. But if you notice, the arrows are bolder between volume and geometry and rotation and projection, and that's because those are most directly related. But they all are interrelated. Anything you do to one will affect the others to a greater or lesser extent. One of the keys to understanding projection and rotation, to me, is understanding the tripod concept. And the tripod concept basically postulates that the tip projection and rotation can be controlled if you think about it as a tripod, the lateral crura being 2 of the legs of the tripod and the paired medial crura being the medial leg of the tripod. And once you understand that and its relationship to the septum, then you can understand that any manipulation of the lengths of those various aspects of the tripod will cause rotation projection to change. And so that's a key concept. And going along with that, the attachment to the septum is another key aspect of controlling that medial leg of the tripod. So a couple of the techniques beyond tongue and groove that I like that I'm just going to describe briefly, and this sort of presages the discussion in the other tip chapter coming up, are lateral crural steal, which is shown here, being measured, and then a dome suture being placed to essentially lengthen the medial crus, shorten the lateral crus, so shift the tripod up. And in the lower diagram, we have lateral crural overlay, which was, of course, described by Kreidel also. And with this, essentially what we're doing is shortening the lateral crura, but we're not lengthening the medial crura, so we're deprojecting and rotating the nose. But the workhorse for me is the tongue and groove technique, and we go into great detail about this in the text. We use a single suture versus multiple sutures. We use a permanent suture underneath the mucosa, so we don't use a 3 transmucosal sutures. And there's some key aspects to prevent some of the complications associated with it, which are shortening the nose and stiffness of the nose. And one of the key concepts is that the suture entry points in each medial crus, shown in those bottom red dots, have to be equidistant to the tip defining points, which are the upper red dots, and the caudal edge of the medial crus. And so that way you make sure that you have an external contour which is symmetric. The crural septal angle of divergence is a concept which we describe, which is this idea that the angle between the caudal septum and the posterior edge of the medial crus will vary from patient to patient. And the more anterior you place your suture, the more of that gap you're going to close, the more of that angle you're going to close, and the more rotation and shortening of the nose you're going to achieve, which you may or may not want. So we go into great detail describing varieties of suture positioning to reduce or augment stiffness, rotation, projection, and columellar show. And so all of these things can be manipulated based on where you place your suture, and I typically use a single 5-0 purling suture for this. So here's some patient examples. This patient had some tip work, dorsal reduction, of course, and in addition to that had tongue and groove, dome sutures for probably some lateral crural steal, and an alar spanning suture. And so you can see the difference in her rotation and projection and the improved stability with smiling that was achieved. Another patient with the same issues, she wanted to shorten her nose in addition to reduce her dorsal hump slightly, and tongue and groove method, along with a little bit of lateral crural overlay, was used with an alar spanning suture to achieve the results you see here. This patient had pretty severe droop, particularly with smiling, and using lateral curl overlay with tongue and groove. We were able to achieve more stability and shorten the nose. And finally, the same concept for this gentleman who had a droopy tip, which was quite dynamic and dropped even more when he smiled. And postoperatively, these are over a year post-op with lateral curl overlay, this time asymmetric because I don't show you his front view, but he had some asymmetry. We were able to straighten the nose, in addition to that, stabilize the nasal tip and rotate his tip upwards. Now, of course, if you don't want to close that angle, then having a stable septal midline construct is important, and it's important that you extend it. So the inline or side-to-side septal extension grafts are very key concepts in supporting tip rotation and projection that are workhorses in my practice and really become very important aspects of maintaining tip projection over time so that your tip doesn't drop. So these are very important things to think about, and we go into much more detail about all these concepts in the chapter. So the key points are that having a stable midline structure, we talked about the importance of that in our chapter on septoplasty and manipulating the septum. But using a tongue and groove on a stable midline construct is very important. There are lots of different ways to alter the tripod, and we go into all those details in the book, but the most important ones to me are lateral curl overlay and lateral curl steel. The tongue and groove is what we use to set the midline stability of that, and understanding the septal angle of divergence and whether or not we want to close that down. The distance from the nasal tip that we want to place our suture is very important in these patients. So all of this is described in detail, and there are accompanying videos. I hope you enjoyed this brief overview. If you want more details, please check out the book, and thank you.